Assessment of ear. Leaning objectives. Identify the component of health history necessary for the examination of ears. Describe color, shape and location of auricle, external ear canal and tympanic membrane and gross hearing. Perform the examination of ear. Structure and function. Ear. The ear is the sense organ of hearing and equilibrium. It consists of three distinct parts. The external ear, the middle ear, the inner ear. External ear. The external ear is composed of the auricle or pinna, the external auditory canal. Modified sweat glands in the external ear canal secrete cerumen, a wax-like substance that keeps the tympanic membrane soft. The tympanic membrane, or eardrum, has a translucent, pearly appearance and separates external ear from the middle ear. Middle ear. The middle ear, or tympanic cavity, is a small, air-filled chamber in the temporal bone. The middle ear contains three auditory ossicles: the malleus, the incus, the stapes. These tiny bones are responsible for transmitting sound waves. Air pressure is equalized on both sides of the tympanic membrane by means of the eustachian tube, which connects the middle ear to the nasopharynx. Inner ear. The inner ear contains the cochlea, a seashell-shaped structure essential for sound transmission and hearing. The vestibule. The semicircular canals, which contain the organs of equilibrium. Hearing. Sound vibrations traveling through ear are collected by and funneled through the external ear, causing the eardrum to vibrate. Sound waves are then transmitted through auditory ossicles as the vibration of the eardrum causes the malleus, the incus, and then the stapes to vibrate. The sound waves are passed to the fluid in the inner ear. The movement of this fluid stimulates and initiates the nerve impulses that travel to the brain by way of the acoustic nerve. Conductive hearing loss is the result of interrupted transmission of sound waves through the outer and middle ear structures. Sensorineural hearing loss is the result of damage to the inner ear, the auditory nerve, or the hearing center in the brain. Subjective data. The nasal health history. Physical examination. Equipment. Watch. Tuning fork. Otoscope. External ear. Inspection or palpation. Inspect the auricle. Normal findings. Ears are equal in size bilaterally, normally 4 centimeter. The auricle aligns with the corner of each eye. Lobes may be free, attached, or soldered. The skin is smooth, with no lesions, lumps, or nodules. Darwin's tubercle, which is a clinically insignificant projection, may be seen on the auricle. Abnormal findings. Malignant lesion. Otitis externa. Palpate the auricle and mastoid process. Abnormal findings. A painful auricle or tragus is associated with otitis externa or a postauricular cyst. Tenderness over the mastoid process suggests mastoiditis. Tenderness behind the ear may occur with otitis media. Mastoiditis. Internal ear. Otoscopic examination. Inspect the external auditory canal. Normal findings. A small amount of odorless cerumen earwax is the only discharge normally present. Cerumen color may be yellow, orange, red, brown, gray, or black. Consistency may be soft, moist, dry, flaky, or even hard. The canal walls should be pink and smooth, without nodules. Abnormal findings. Buildup of cerumen in ear canal. Polyp. Exostosis. Inspect the tympanic membrane eardrum. The tympanic membrane should be pearly, gray, shiny, and translucent, with no bulging or attraction. It is slightly concave, smooth, and intact. Abnormal findings. Acute otitis media. The red, bulging membrane, decreased or absent light reflex. Blue, dark red tympanic membrane. Indicates blood behind eardrum due to trauma. Perforated tympanic membrane. Perforation results from rupture caused by increased pressure, usually from untreated infection or trauma. Serous otitis media. The yellowish, bulging membrane with bubbles behind it. Scarred tympanic membrane. White spots and streaks indicate scarring from infections. Retracted tympanic membrane. Prominent landmarks are caused by negative ear pressure due to obstructed eustachian tube or chronic otitis media. Hearing and equilibrium tests. Whisper test. Weber's test. Rinner test. Romberg test. Common problems and conditions. References. Janet R. Weber, Jane H. Kelly, Do Suffer Ek Char, Health Assessment in Nesang Panchama edition. Philadelphia, Lippincott Williams or Wilkins. Susan Fickett Wilson, Jean Forrest Giddens, Do Suffer Ek Saath, Health Assessment for Nesang Practice Chutta edition. Elsevier, Inc. Cozy and Hubs do suffer एक fundamentals of Nisang Disma edition. Pearson Education, Inc. Linnes. Bickley do suffer एक साथ Bates, Guide to Physical Examination and History Taking, Badavam edition. Walters Kluwer.